little pathology here, a little bit of understanding of background what mastitis is, or clogged ducts. Oftentimes women with infrequency of their breastfeeds can, as Sarah said, it's a bunch of clustered grapes together. And ever got a pimple before and you try to pop that pimple, think of it the same way. There's no outlet for that flow. And when that happens and there's a buildup, sometimes an infected source can build. For instance, when the baby is gnawing at the nipple, it can allow like some bacteria to get in, allow that area to get clogged and creating like a red area, tenderness. And there are a few things that women can do before jumping to antibiotics. We want to make this as smooth as possible. Now, I'm not an antibiotic person. I encourage my patients when it's necessary. So what are some things that we can do for mastitis are, for instance?
Yeah. So number one, the best way to avoid a clogged duct or mastitis, which is worst case scenario, is to feed your baby really often. Think of your baby as the one ordering the food at the restaurant. And if they come to the table often enough, the food is going to come through your body in a way that's not going to get built up, as you said, or backed up. The other thing you can think about is your ducts are kind of like a pipe system. So if milk gets kind of stuck to one of those pipes, it can get stuck.
Crusty, like almost, yeah.
Exactly. So taking something like sunflower lecithin, which is a natural emulsifier, really helps kind of unstick that fatty milk that can get stuck in the ducts. But if you're removing your milk efficiently because baby is at breast doing his or her job well, you should be totally fine. You shouldn't even get to the point where mastitis is an issue.
Right. And in the cases like pathologically, if you get to a point that you need to really manage that, see your doctor. Don't just call over the phone and say, hey, I need antibiotics. Come in, let us take a look at it. Let's give you some advice. There are warm compresses, massages, things that you can do. And if there are worst case scenarios, we give antibiotics. And sometimes if it's not really well taken care of, there's some interventions that need to be done. But don't jump to conclusions is I guess what we're trying to say right now.
Exactly. And also work with an in-person LC who's going to give you a really good plan of care to manage everything before you even need to go down the route of potentially asking for antibiotics.
That's why we're collaborating.
Yeah.